EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor. Good afternoon, and welcome to Community Conversations. My name is Vicki Soule. As the intro said, I am the CEO of Treasure Coast Community Health, and proud to be here every week bringing folks from around the community to share information in a conversationally attractive way, I hope. And because we have so many great collaborators, it is once in a blue moon that we have our own staff on. But just like things are happening all over the world, it must be a blue moon day because I've got two of my folks here that have some special things they want to talk to you about. So welcome, Isabel. Isabel Hernandez is one of our erstwhile employees. You've been with us for how long?
14 years.
Oh my gosh. Yeah. I was going to guess a lesser number. And Dennis?
10 years.
10 years. Yeah. So got you both beat by 1 year. But anyways, we're so glad that you're here because you have so much information that you tuck in your brains and help us with every day. So it's good that you can help the community with this. Isabel, we're coming up to a special time of year that you are aware of. So lay it out for us.
Yes. So I wanted to talk to you guys about open enrollment for Medicare.
Okay.
So open enrollment starts October 15th to December 7th. So please be aware that this is an opportunity to sign up. People can be available for Medicare when they turn age 65. A is for hospital benefits, Part B is for primary care services, and then there's Part D, which is for pharmacy, so prescription services there.
But Part A and Part B also cover some medical medicines, correct?
That is correct.
Okay, so yes. D is like the extra.
Yes. So anything may be something that's not administered in the clinic setting or primary care setting.
Okay, and so there is a Part C as well.
That is correct. So Part C is additional services, and it's for Medicare Advantage plans.
Okay.
This is why I believe it's very important to understand your health status, where you stand, so that you know how to make these decisions for yourself.
Yeah, we hope you never have to use the Part A hospitalization.
Correct.
Okay.
Yes.
In fact, we encourage you to get as much preventative care at your doctor's office as you can. But, things happen. And if it's possible to first consult with your doctor instead of going to the emergency room, that's certainly better for everyone. It keeps the crowds down, so the most acute cases can go there. But it also helps financially as well.
It does. Services that are rendered at the hospital can also be rendered at the clinic setting. And also more attention to detail can happen at the clinics because there's more time.
So there are a couple of things that can't be, like, a colonoscopy.
Correct.
But now I understand that there's better testing that can be done at your home.
Yes. So there's services like Cologuard. It's a test that can be done at the privacy of your own home. It's a kit. You will do it at your leisure, and you can send it off in the mail. Very simple test to do. That test is good for 3 years. However, if you have a family history of colon cancer, it is recommended to have a colonoscopy. So it's very important to understand and know your health status and your family history.
Well, and the reality is that the Cologuard is covered by insurance generally. And while a colonoscopy is as well, I have a son who took the Cologuard and it turned up positive. And so he's like, so now I have to do the prep and, the whole deal.
Yeah.
So he was really hoping that it would be negative. Sorry, I He told me it was okay to share. I didn't violate HIPAA, I swear. But, those are the pros and cons of doing something that you can do through your doctor's office as opposed to waiting until, it might be a little beyond a routine negative.
Correct. And with preventative services, whether it's a physical or an annual wellness visit, these are benefits to you without a copay.
For Medicare?
Yes.
Okay.
So especially the annual wellness visit, which is very important. So understanding your health status is very important because then am I going to have to see a specialist in the future? What does my health look like right now? And what is it going to look like in a year from now or even 6 months, depending on your lifestyle, right?
Mm-hmm.
So a benefit to having an annual wellness visit once a year is that you get a hearing test along with that, a vision test. And then you also have other questionnaires or assessments that are part of that annual wellness visit, which help tremendously. For example, ADLs. If you have a family member that's in their maybe 80s, are they still able to dress themselves, bathe themselves? And those things are very
activities
important.
of daily life. Took me a minute. ADL.
Yes.
Okay.
Correct. Sorry.
That's okay.
Yes.
Medical jargon.
Yes. And it's very important for the value of lifestyle that your family member may have or that you may have in the future.
And those are covered by Medicare?
Yes.
The wellness exams
Annual wellness visit at no copay.
Daily living things like bathing an elderly person.
So
the assessments.
The assessments.
The assessments.
Okay.
Yes.
Yeah.
Then there's referrals that could be put in to help with that if it's needed.
For physical therapy or occupational therapy. But again, as you were saying earlier, the Medicare Advantage plans, a lot of those things you were talking about an experience you had where they had to be pre-approved.
Yes. Recently, I had injured my arm and I needed physical therapy, but I have the Medicare Advantage plan.
Mm-hmm.
But in order to get to the physical therapy, I had to have the physical therapist give me a letter saying that I needed it. Then I had to go to my primary care doctor, who had to refer me back to the physical therapist. And then when I got there, that particular doctor or therapist their agency did not accept my Advantage plan. Consequently, I had to go to a whole different place and start over.
Oh my gosh.
Yes.
And that's the disadvantage of Advantage plans because they are private brokered insurance plans as opposed to Medicare, which is a federal government plan. So I don't know of anybody that doesn't take Medicare. You walk in and that's not an issue.
As a matter of fact, they asked me that at the initial physical therapist. If you just have Medicare, we could just charge Medicare. It's no problem.
Right.
So it was like, oh, well.
Oh, yeah, whoops.
I know.
Yeah.
So now I'm in the process of trying to determine my wife, who is about to turn 65, if she needs, do we need an Advantage plan? Do we need a Medigap plan? Or do we just stay with straight Medicare? And so all of this conversation today is really good for me.
Yeah, well, thank you, Dennis. I'm sorry I didn't introduce you. I was facing Isabel, and you've been here before. And,
yeah, I've been here before, and I'm here for ducks today. Ducks,
okay,
we'll talk about those later.
We'll talk about ducks. This is an info session.
Yeah, right. But Medicare, I mean, this is really, it's really kind of confusing when you're about to turn 65, and I'm sure many people, and I'm in this field, and I don't get it.
Yeah.
And I said, my office is across from Isabel's. So today, I'm going to be over there picking her brain after this to say, what do I need to do?
Well, Medigap and supplemental Medicare has been around for a very long time, okay? But then some of the insurance companies started tweaking their plans, and so out of that was born the Medicare Advantage plans, and they are all different. And, of course, they all have things that they cover or don't cover. Traditionally, for example, Medicare will not take care of a tooth extraction, okay, but they will take care of a biopsy. So if you don't have dental insurance, your Medicare is not going to take care of a tooth extraction. But if you have a spot on your tongue and they need to biopsy that, then Medicare will, because that's medical oriented, okay? So the Medigap was coming in to help with some of those 20% copays, for example, the supplemental insurance. Because if you had a hospital visit, your copay could be quite large
Sure.
Again, depending on, where and how.
So are there copays with Medicare? If I got put in a hospital, is there a limited time that you could stay in the hospital? Is there a copay with Medicare?
Well, that's very interesting because my husband's been in the hospital recently. And so he was told that if he only stayed one night over midnight, that's considered an observation. And the Medicare, they treat it more like outpatient work. So there is a 20% copay.
Mm-hmm.
But if you stay overnight, midnight, 2 or more nights, then it's covered under your Part A completely.
Wow.
Okay. So again, different circumstances and different rules apply. And I'm not an insurance broker, so take this all with a grain of salt. Okay. But we learn a lot from life experiences of others.
Absolutely.
And
That
ourselves.
is so true. Patient care.
That's
Yes.
right.
So with traditional Medicare, like you mentioned before, you wouldn't have had those barriers. Because as soon as you get a referral, whether it's the hospital that issued the referral or whether it's a specialist, you can take that referral anywhere and most likely they will see you and schedule your appointment.
So I wouldn't have had to go through my primary care doctor to get a referral. I could have just gone right to the therapist.
That is correct.
Knocked on the door and said, I need physical therapy on my arm.
That's true.
Well, see, that's an advantage
Yeah.
over the Advantage plan.
Correct.
But again, as Isabel said, it's really about knowing your own status. If you have got a chronic disease like hypertension, well, blood pressure pills are pretty cheap these days.
Yeah.
Okay. But if you have something else that pops up, maybe your breathing is getting more difficult. And so now your lung is involved, and maybe they put you on some different medications or some COPD stuff for chronic obstructive pulmonary disease. Maybe those medications aren't as inexpensive, and looking at a different plan, or maybe you have multiple medications. A lot of us are getting there. Again, talking with someone who's knowledgeable in what the supplemental plans versus the Medicare Advantage plans are, and thinking it through, because again, not to be a skeptic, but insurance agents make their wages through commissions generally.
Sure.
And so they have a real vested interest in telling you all the advantages of the particular plan that they're selling. And I found out, again, through experience, that they can only broker for one insurance plan, whether it's Blue Cross or United or Aetna or Cigna. They can't say, well, we'll do all of it. Now, most federally qualified health centers like ourselves do offer that non-judgmental information across, and there are websites as well that are set up so that you as an individual can do that, just like you can originally enroll in Medicare online. Okay. But we're here to help. So if you're not computer literate, give us a call. We'll take care of you. But we're going to take a short station break, and we'll come back with more information for you. Thank you. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
It's hurricane season. Prune your trees now with Scott Tree Services. Strengthen your trees against high winds and remove broken limbs that could cause damage. Don't get nervous. Call Scott Tree Services.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs in all the latest styles and colors from Tommy Bahama, Lexington, Hooker, Riverside, Universal, Four Seasons, Braxton Color, and Capri. We're the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of Berlin Gardens and Bollywood. neighborhood. We specialize in fire pits, outdoor rugs, umbrellas, and replacement cushions. Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Family owned and operated since 1991. Don't forget to visit our outlet store directly across the street, filled with lots of name brand closeouts and sale items. Visit our website at sunshinefurniturecasual.com.
Sunshine Furniture, the best in every way. Have a sunshine day. Sunshine.
Sturgis Lumber is the county's most trusted hardware store. Sturgis stocks stainless steel products, power tools, construction and painting supplies, propane, plumbing, and electrical parts. 4645 US 1 Vero Beach. Sturgis Lumber and Hardware.
And welcome back to Community Conversations. If you're just joining us, we are spending this hour talking about the wonderful things that can be done as you approach Medicare age. And I have with us today Isabel and Dennis. Dennis has been with us a very long time and has been out, but we all have familial stories to share.
We do.
He said that his wife is going to be approaching that decision of what to do relative to Medicare and insurances. And Isabel has just been telling us about the importance of annual wellness exams. And they're really not an exam per se, are they, Isabel?
Not the annual wellness visits. It's more of assessments that check your overall care. So, for example, a depression screening is part of an annual wellness visit, an anxiety screening. Also, cognitive tests. So, for example, some people may have this where it runs in their family where they have dementia. So this has a screening, this annual wellness visit. It's part of a cognitive test where they go over certain questions to see if you're still understanding or knowing certain aspects.
Because sometimes family misses the signals because you're with them all the time.
That is correct,
Okay.
yes.
So most of the annual wellness visit is done by a registered nurse?
Yes, it's usually done by a registered nurse with the provider as well. So with these assessments and questionnaires, if there's any positive findings, this prompts the provider to say, hey, we need another visit and we want to talk more in depth about this particular finding, whether it's a depression screening or cognitive.
So it's sort of like taking your car in for the 3,000 mile, well, I guess now it's 5,000 mile checkup, right?
That is correct. Yes. Just like a car needs an oil change, we do as well.
I know.
So we need to make sure that also we're on top of that preventative care. So during the annual wellness visit, they also let you know what you could be due for to prevent further hospitalization. So for example, you'll get an education regarding breast cancer, you'll get education regarding colon cancer, and also cervical cancer. Those are very important, especially when detected at an early stage. They're very curable.
Well, and I have to give another prompt about colon cancer because whether it's the water or the additives and nitrates that they put in our food or whatever it is, we're finding more and more people positive for colon cancer at younger ages. It used to be, just an old person's problem. And now we're detecting it in people in their 40s and 50s. And unfortunately, if you don't detect it early, then the consequences are so much more severe in terms of surgical being the primary way that you get rid of cancers. Well, you don't really want to get rid of part of your colon, right?
Yes.
So if you are on top of it, if there's any positive findings, a colonoscopy will remove, that little bit of problem before it gets to be a big problem. So I know it's a yucky subject and nobody wants to talk about it, but with Cologuard and with other methods, it really is something that everybody, particularly those that have got any colon cancer in their family history, really in the 40s, you need to do that.
Even 30s. I've personally have a family member, early 30s, positive for colon cancer.
Wow.
Yeah, wow.
The additives in the food and all the things that we eat and we breathe and everything else that's going on in the world.
Yeah.
Yeah, I know. And the worst part about a colonoscopy is the prep.
Yeah.
Once you're through that stage, the rest of it is.
But even those are getting better.
They
better
are.
Flavors and shorter acting and all that stuff. So it's, as I say to my family, it's one day out of your life.
That's
and
right.
You know, I have a nephew who has struggled with stage 4 colon cancer that metastasized, and he
Wow.
had part of his lung removed. Again, he gave me permission to talk about it because he said, I never, ever would have guessed in my 40s that because he had no family history. And he said, you know, it just hit me broadside. But
Yeah.
he's very determined to beat it. But it has been a very tough couple of years for him. A lot of stress on his family.
Yes.
What are the symptoms of?
Sometimes it's diarrhea. Sometimes it's bloody stools.
Some people may think it's a hemorrhoid when it's not.
Uh-huh.
So just some little difficulties there.
Right.
So talk to your doctor about
Yes.
it. Don't wait until you're doubled up in pain or you absolutely positively know there's a problem. Talk to your doctor when you think things are just not right. Okay.
Mhm.
Yeah. Preventative care is very important, and it's very vital to our community. So, for example, let's say you have a household where there's 2 working individuals there, and maybe the school keeps calling them to come pick up their child. And so now one of the parents has to leave work to go pick up the kid, and it's happening more often. Now their employer is like, well, you're having to leave a lot, you know, we need someone that needs to cover this shift. When in all reality, the child just needed a well visit because they're having an hearing impairment. So it's not that the child is being malicious. It's just that there was an issue there that needed to be addressed. And these are things that can be caught during preventative visit, like a well visit or a physical. And it's very important. So if
For
you're
all
of the
ages.
age, yes, all ages, where we're talking about 65 and older, but also 30 and older children, because then that carries into our
even teens.
community. So, for example, let's say this child didn't get to make it to their well visit, and now you have someone that could have lost their job, and then that pours out into the community.
It's
So-
interesting that she mentions that because the Duck Derby this year is for women and children's health care. People who can't afford the care that they need, children and women, oftentimes will, the kids, I mean, your parents are taking their kids out of school, not realizing their kid can't see right, can't hear properly, he has a toothache, is not paying attention in class, a number of reasons. Anyway, this is the annual Duck Derby. It's our 12th year of doing this. And this event raises money. Every dollar raised from this, including sponsorship dollars, and every $5 duck that's adopted, because it's only $5 to adopt a duck. And every dollar goes to women and children in this county who can't afford health care that TCCH provides for them. So we have that coming up where we put these little guys in the water at Captain Hiram's, and this is the $5 duck. So if you haven't adopted your duck yet to support women and children, you're not adopting a duck for a race. What you're doing is you're putting $5 into a pot that's going to give some kid or some woman the health care, the screenings, or whatever that they need. And we find cancer, we find all kinds of things with these screenings, and that $5, $5 little dollars, helps prevent that from happening to somebody. We also have a new thing this year is we have the corporate duck race, which is this big duck. And if you're a business, this is businesses racing against businesses. Only 100 of these will go in the water. And if you have a business and would like to sponsor that, call me at 772-571-1985. And that's Dennis at 772-571-1985.
And unlike the little ducks, the businesses can decorate as long as they float,
As long
right?
as it floats,
As long as
it's
they
got to
float.
float. You could decorate this thing to the max as long as one guy said he's going to make it remote controlled.
Oh,
So you can, and I said that's cheating. I don't
yeah, I
think
don't
you
think
can
that's
do
going to
that.
work. But you
Anyway.
got to give them an A for ingenuity.
I know, absolutely.
But oftentimes we'll say, well, how do I know that's my duck? You know?
Yes.
So for businesses, you can vamp them up to reflect your business.
Definitely put your name on it so we know who the winner is.
Absolutely.
Yeah.
But if you want to spray paint them to be a different color,
Yes.
you know, maybe a little red stripe down the middle, you know, whatever you want to do.
And these little ducks, the prize is $2,000 for first prize, $1,000 for second prize, and $500 for third place. And so for $5, you have a better chance at winning this than you do the lottery. So
And that's November 4th, right?
November 3rd at Captain Hiram's.
Okay, November 3rd.
Noon to 4.
Okay. Well, thank you both very much for being here this week. Again, I hope that this has been an interesting conversation for you to listen to. We certainly enjoy every minute that we're here. So have a great afternoon, and we hope that you will get online at thegreatduckderby.com and get yourself a couple of ducks to adopt. Thank you. See you next week.